A 10-year-old boy is brought to the pediatrician by his parents for evaluation of short stature. The child is below the 10th percentile for height. Both parents are of average height and state they were average height among their peers at age 10. Thyroid-stimulating hormone levels are at 0.01. The normal value is 0.4 to 4. On physical exam, the patient has difficulty with peripheral vision. The cornea reflex is intact, and the MRI of the head reveals a suprasellar cystic, calcified mass. As seen in the figure, what is the most likely diagnosis? The hallmark lesion for craniopharyngioma is a suprasellar cystic calcified mass. As seen in the figure, the differential diagnosis for a suprasellar mass includes optic gliomas, meningiomas, pituitary adenomas, and metastases. What are other causes of short stature? Other causes of short stature can arise from endocrine disorders, including Cushing's syndrome, growth hormone deficiency, hypothyroidism, and gastrointestinal disorders including malabsorption syndromes such as celiac disease, lactase deficiency, or inflammatory bowel disease. Dwarfism is a condition that can be diagnosed even in the prenatal stages. Achondroplasia is due to an autosomal dominant gain-of-function mutation in the fibroblast growth factor receptor 3 gene. From what tissue does the tumor in this condition derive? Craniopharyngiomas are rare tumors derived from the pituitary gland's embryonic tissue. The adenohypophysis, anterior lobe of the pituitary gland, derives from Rathke pouch, an invagination of ectoderm lining the roof of the primitive oral cavity. The remnants of Rathke pouch can give rise to craniopharyngiomas. The posterior lobe of the pituitary neurohypophysis develops from the infundibulum of the hypothalamus. What tests or imaging tools may be used to confirm the diagnosis? CT scan or MRI of the head can visualize the cystic calcified suprasellar mass characteristic of craniopharyngioma. Plain radiographs of the skull can detect advanced cases. Testing of the pituitary axis and optic pathways can determine whether the tumor has affected these structures. What is the epidemiology of this condition? Craniopharyngiomas exhibit a bimodal distribution, with one peak among children and the second among patients 55 to 65 years of age. It is the third most common intracranial tumor in children. What are the clinical manifestations of this condition? Craniopharyngiomas are slow-growing tumors with a highly variable clinical presentation. Symptoms occur because the tumor involves the pituitary gland or the optic chiasm. Patients may present with growth hormone deficiency, hypothyroidism, or central diabetes insipidus. These hormonal deficiencies are due to mass effect from the tumor on the normal tissue. Visual disturbances and headaches are common due to compression of the optic chiasm. Examples of visual disturbances include bitemporal hemianopsia and tunnel vision. The patients may complain of difficulty with peripheral vision. What neurological structures would be affected due to clot forming in the venous sinus above the pituitary gland? Cavernous sinus thrombosis is a condition where a thrombosis develops within the cavernous sinus. This can lead to occlusion of the dural sinus and elevation of intracranial pressure. Clinically, this condition manifests as headaches due to increased intracranial pressure and may be accompanied by vomiting, periorbital edema, fever, facial pain, papilledema, and reduced visual acuity and ocular motility disturbances. Cranial nerve palsies are common. The palsies can involve cranial nerve 3, oculomotor, 4, trochlear, 6, abducens, and the first and second branch of cranial nerve 5, trigeminal. The most common cranial nerve that is affected is cranial nerve 6, abducens. What is the best treatment for craniopharyngioma? The treatment of craniopharyngiomas is primarily surgery and radiotherapy. The surgery can be performed via either a transcranial approach through an open craniotomy or an endoscopic transnasal transsphenoidal approach. The prognosis of craniopharyngioma is good, but the quality of life is low due to hypothalamic and endocrine deficiencies.